Hey guys, Oscar here with Gastroenterology Simplified, and today we're going to talk about Mirizzi Syndrome. The reason I want to talk about this diagnosis is because I do not remember learning about this diagnosis when I was in PA school, and I do see this diagnosis once in a while when I'm rounding in the hospital. It is a rare diagnosis, but it does exist. What is Mirizzi Syndrome? Mirizzi Syndrome is a rare complication of a gallstone getting stuck into the cystic duct or neck of the gallbladder. Now, this stone causes compression, erosion of the common hepatic duct, and causing bile duct obstruction. What are the causes of Mirizzi syndrome? It is usually caused by long-standing gallstone or by chronic inflammation of the gallbladder. What are the symptoms of Mirizzi syndrome or acute cholecystitis, which it could be very similar? Well, the patients usually present to the hospital with acute radial abdominal pain, nausea, vomiting, fevers, chills, jaundice, icterus, dark urine, and sometimes pale stools. So after gathering a good history from the patient, you suspect the patient has acute cholecystitis or possibly Mirizzi syndrome. How are you going to diagnose this? You're going to obtain an ultrasound of the radial quadrant or a CT of the abdomen and pelvis, and in rare occasions when you suspect cholecystectomy as well, you're going to get an MRCP, which is an MRI of the abdomen. In rare cases, you could do an ERCP, which could be therapeutic as well as a diagnostic too. But you have to keep in mind that an ERCP is invasive and it does have risk. So therefore, you go with an ultrasound, CT scan, or an MRCP first, and then you jump into an ERCP if needed. After you obtain a good history from the patient, you get blood workup, CBC, CMP, liver enzymes, and so on. Then you want to actually treat the issue. So now you have the diagnosis of Mirizzi syndrome and you want to actually now treat it. What are you going to do? Well, you need to consult the surgical services, and the surgical services likely are going to take the patient to the OR and they're going to do a cholecystectomy, which is a removal of the gallbladder. This usually fixes the issues. In rare occasions, if they do a cholecystectomy with an intraoperative cholangiogram, and if the intraoperative cholangiogram is positive, then you need to consult advanced GI to proceed with an ERCP. The ERCP is going to remove the stone that is likely stuck in the common bile duct. And usually a stent is placed and the stent is left there for about 6 to 8 weeks and then removed later on with a repeat ERCP. Now the patient is fixed, you did your job, the patient did well, and the next day you're going to go ahead and repeat some blood workup, make sure the patient is eating, the pain is less, the liver enzymes are trending down, the icterus and the jaundice is improving. Make sure the patient has a follow-up visit with gastroenterology, surgical services, and the PCP. And that's it. If you found this video helpful, please click like, subscribe, and I will see you on the next one.